ESC TV. I'm Juhani Knuuti from Turku, Finland. I'm talking and discussing about the future of imaging with Udo Sechtem from Stuttgart, Germany. So, Udo, what do you think? How do you think about the imaging here in the ESC Congress today? How it looks if you think about what happens in the near future?
Well, I think we have a broad spectrum of imaging sessions here, which give a perfect overview of what is going on today. The future, I think, will not be overwhelmed by new technologies. I don't see much on the horizon which is revolutionary new, but there are some improvements that we would like to see more broadly applied in the field, such as PET-CT, for instance, very expensive but excellent. And this is, I think, what needs to be thought about in the future.
What do you think about the combination of therapy guidance and how imaging could guide the therapy? Yes, because that is the challenge today. We have a lot of possibilities, but how to use this imaging information to really guide the decision what to do with the patient?
That's a very good question. I think that it is very important that the clinician is able to interpret the images to really bring it all together. Because when you just take part of the clinical information, part of what the imager tells you, and then make a decision, that decision may be suboptimal. The other thing that we have to think about is how we can improve our prediction of response. For instance, how can imaging help to select the ideal patient who will get an ICD? Unfortunately, we had a trial set up with MRI as a predictor, but there was a patient recruitment problem, so we don't have the answer yet.
What do you think? How could we solve this question, which is actually crucial for the future of imaging? To really have an evidence-based information about the role of imaging in guiding therapies. What can we do?
Well, in the end of the day, we need trials. We need randomized trials with and without imaging. But these trials are very expensive. They will be very difficult to do. So I think the near future, we will apply imaging just as we did. We should apply it carefully, we should apply it with a look at cost, and we should apply it only when absolutely necessary.
One of the areas where the imaging has been very often used is coronary disease. Now the new information about the medical therapy is also very much evolving, and then the potential benefit of doing an intervention is sort of questionized more and more. So what do you think? How should we use imaging in that kind of situation where the evidence is actually not much supportive?
Well, the evidence is still there that imaging is able to select the high-risk patients. The problem is that the effect of an intervention as compared to medical therapy is rather small, but that is not the fault of imaging.
Okay. Thank you very much for this short interview.
My pleasure.